Dr. Jody Greenfield, welcome to the Tick Bootcamp podcast.
Thank you. Nice meeting with you guys today.
Yeah, well, I'm particularly excited about interviewing you because you and I speak the same dialect. You're actually a native New Yorker despite having been a transplant to Florida.
Yes, I've been transplanted to Florida for 10 years, but I grew up in Brooklyn until I was 13, then moved to Long Island after that, and moved to Florida about 10 years ago.
Now, it does not surprise me that you'd have a passion for tick-borne illnesses, having spent a good portion of your formative years in the Lyme Belt, right, over in Comac.
Yeah, and my old office was in Babylon, actually, not too far from the ferries to Fire Island. So I had many patients that got it in Fire Island, actually.
Wow. Well, I mean, I think you could get Lyme disease anywhere on Long Island, right? I mean, we get bitten all the time, and I actually grew up in Long Island. I was bitten by ticks my entire life. I mean, it was just a very, very common experience for Long Islanders, and it's becoming unfortunately, a more common experience for folks all over the country, which is, I guess, all over the world, which is really a sad thing. So let's first talk about your background. Where'd you go to school, and what gave you the passion for healing?
Oh, well, I went to med school at New York College of Osteopathic Medicine in Long Island, New York. I was actually in the 10th graduating class. It was a pretty new school back then.
All right.
And I went to be a doctor basically since I was a baby. I always wanted to be a doctor. And I was a doctor, internal medicine doc, until around 2007. I started getting some weird symptoms. And I was wondering what was going on. I went to the doctor. They said, there's nothing wrong with you. I had multiple tests done. Went doctor to doctor to doctor. Nothing's wrong. And I knew something was wrong, but couldn't figure out what it was. I said, maybe it was Lyme disease. I went to some doctors. They didn't believe in that. So as it turns out, I had a cleaning guy from my old office who was a nurse. This was his part-time job, and said he had Lyme disease. He ended up having pick Lyme. Told me all his symptoms. I said, that's what I have. So he hooked me up with his doctor, who was one of the ILADS founders, actually. Met with him. He said, I have it. I was treated. I was very ill at that point, but luckily I got a lot of treatment, got better, and I ended up getting along with that doctor. I ended up working with him in his office. He became an ILADS member, etc. Eventually, now I'm on the board of directors, so I got a lot of, it was an interesting journey.
All right, well, but you can't just tease us with a doctor generally. Who was the doctor who treated you?
Oh, Dr. Bernard Raxlen.
All right, so that is I guess exciting and sad on a number of different levels. Let's talk about the sad piece of this, right? And the sad piece of this is clearly a very smart man. You graduated from one of the top medical schools, certainly in New York, and despite having the medical training that you had, working as a practitioner, and now, of course, being in your own body, you couldn't diagnose yourself with Lyme disease.
Well, I questioned it, but again, it was so controversial. As doctors, we don't get enough good information about it at that time. Now there's ILADS and groups which gives a lot of information. Back then, there's very little information available, so it's very difficult to diagnose then. It's still difficult, but it's better now compared to back then.
But you went to medical school on Long Island.
Right.
And you know, you're not going to find a more densely endemic Lyme disease community, right?
Right.
So let's first talk about when you were in medical school. Were you given any training on Lyme disease?
From what I remember, it's a long time ago. From what I remember, it was like a day, probably, like one course.
Right. So
that was it.
Well, one day of one course or one course?
Oh, it was probably like an hour.
Okay.
And it was about acute Lyme disease. It wasn't about the chronic situation of people that were difficult to diagnose. It was you have to have the bullseye rash. And a long time ago, from what I remember, that was about it. Short course of antibiotics, and you're done.
Okay. So now you seek out medical treatment from another doctor, and of course, I will share with you, I've represented many lawyers in my career as an attorney. I'm always more careful to make sure that I'm giving them the highest quality service because they're a colleague. And I'm sure you doctors do the same thing with your colleagues. You went to a colleague for treatment, and the colleague still didn't diagnose you with Lyme disease.
Right. First colleague was a classmate of mine, actually. He was a neurologist. He was a very good one, actually. And I went to, eventually, Columbia, New York City is supposed to be the top neurologic center in the planet.
I'm going to move this on. Keep.
And I was told I'm too skinny. I've always been skinny, and you inherited something. That's probably what it is. And there's nothing wrong with you. Go home.
Wow. We keep seeing the same pattern happen over and over again, and I think it's important for the patient community to understand that it doesn't just happen to them,
right?
But it also happens to those of you who are insiders. Right? You're a doctor.
Yes.
You're an insider, and you had the same challenges. Now let's talk about why that's happening, right? In my view, it's happening because, and please correct me if I'm wrong, we have an acute care system, and those of you who are now educated to work within that system are really trained to focus on being acute care practitioners. Am I right about that?
Well, that's true. That's basically, yeah, basically that's it. Yes.
So
Acute problems, yes. Chronic problems, not as much focused on.
right, and the reason chronic problems are not focused on is because we don't have a chronic care system. And we don't have a chronic care system because in order to be able to properly treat chronically ill people, you need more than the 15 minutes that insurance companies are going to offer to you when I come into your office, right? If I come into your office and I'm an insurance patient, for you to be paid a fair amount of money for the service that you're going to be providing, the insurance company is going to limit your contact with me to less than 15 minutes.
Right. When I was in Long Island, I did primary care practice, and that's what happened. I accepted insurance back then and visited so much faster. Now I see mostly Lyme disease patients, so people with mold or complex chronically ill patients. Visits are an hour, sometimes more, and visits are 2 hours, sometimes more.
Yeah. So I mean, if you're going to have a medical system that is going to adequately treat chronically ill patients, the physicians are going to need an adequate amount of time to diagnose and treat those patients, right?
Yes, and the insurance basically doesn't allow for that, or you won't be able to keep the lights on in your office.
Right. Well, you wouldn't be. You absolutely would not be. You'd be bankrupt, right? I mean, it would be impossible.
Essentially, right.
If you
spend this much time with the patient.
Right. If you spent 2 hours with a patient, or 3 hours with a patient, and you were paid for 15 minutes, you would not be paid an hour a day, and you would have already worked overtime.
Right, and it's not unusual to have a new patient with Lyme disease that takes 3 hours for initial visit.
Right.
And if you're getting paid for 15 minutes, you can't stay open and you won't be able to help any patients.
Right. All right. So now let's now focus on your journey. So how do you find the Lyme-literate doctor that you found to diagnose you?
I don't understand what you asked me.
So you said that you found an ILADS doctor, a
Right.
Lyme-literate doctor, to
Right.
treat you. What you were not able to diagnose yourself.
Right.
You were actually failed by the initial practitioners. Actually, I didn't even know it was a classmate, but a classmate who certainly would want to do everything he could for you.
Right.
You were misdiagnosed. You finally were properly diagnosed by a Lyme-literate doctor,
Yes.
an ILADS doctor.
Yes.
How did you find that doctor, and why did you look for that doctor?
Well, what happened was I was in my office, and I happened to have a new cleaning guy who was cleaning up the office, and this was his part-time job. He was really a nurse in the local hospital. This was his side gig. And he told me he got a PICC line. I'm like, what do you have a PICC line for? He says, I have Lyme disease. How do you get that? He said, tell me the story. Tells me all the symptoms, one at a time. I'm like, that's what I have.
All right. So I thank you for reminding me of that, because you did share that with me a minute ago, and that was the next piece I wanted to talk to you about, because one of our favorite podcast guests was a woman named Phyllis Bedford, and Phyllis Bedford has described Lyme disease as the supermarket disease, where you're more likely to be diagnosed in the supermarket than you are in your doctor's office, right? Because folks who are suffering from the disease, or had been suffering from the disease, or their family members become familiar with the symptoms, and they pass it on to other people who are struggling with getting a diagnosis from medical professionals. And you, as a medical professional,
Right.
had to have a cleaning guy,
Right.
and I know he had some medical training, but a cleaning guy describe his symptoms to you for
Right.
you to finally be diagnosed. So you are the classic example of a supermarket diagnosis.
Yes, and basically he went in my office in the back, and he called up his doctor to get an appointment for me.
And that's how you found your Lyme-literate
That's how I
doctor.
found my Lyme-literate. He said he searched all over America because he was going doctor to doctor to doctor. Because he knows he had tick bites. I believe it was in Latin America he found in South America. And he had ticks all over himself, and basically he had Lyme symptoms. Every test was negative until he found this person. He did further testing on patients.
Do you recall having been bitten by ticks during the course of your childhood on Long Island?
Actually, no. Right before I moved to Florida, though, I did get a tick bite, but looking back on it, but I was sick a little bit before that. It just got worse at that point.
Yeah, so I think one of the things that's also important for folks to understand in this community is that 80% of the people who have chronic Lyme disease do not recall having been bitten by a tick. And that's because these vectors are very good at being stealthy. And even though those of us who are living in tick endemic communities are being bitten all the time. In most cases, we don't find them. And I've shared with folks on our podcast that it wasn't until I became Lyme woke,
Right.
where I started checking myself now twice a day to make sure that a tick would not be feeding on me long enough to transmit, or hopefully not long enough to transmit, these tick diseases to me. I find ticks on me all the time, right? So when I wasn't checking, I wasn't finding them. When I am checking, I am finding them. And my co-host...
Really tiny. And they're like the warm areas of the body, like the armpit and the groin, behind your ears. So you really got to look carefully.
So there's no doubt in my mind you were being bitten by ticks all during
Yeah.
your childhood, and you just didn't know it, right?
And I spent time in the woods. I would go to the Poconos, upstate New York.
Yeah.
I loved being in the woods.
Yeah, but you know, and the other thing we should also remind folks is that 80% of the people who are diagnosed with Lyme disease and have been bitten by a tick are bitten by a tick in their own backyard. You don't have to go to the Poconos. You don't
Right.
have to go in the woods.
Right.
You just have to be in your backyard.
Yep.
And it's very likely that's where you're going to come in contact with a tick. So now let's talk about how you were treated differently by the Lyme-literate doctor that your cleaning person referred you to than you had been treated by the other doctors. What was different?
Oh, he asked a much more extensive history form with more questions were being asked. He spoke to me for a longer period of time. He took a more thorough history, I would say, and he recognized it as the symptoms of Lyme disease and actually co-infections as well. So he recognized it based on my story, based on where I lived also. He said, same thing like you. You could have just got it in your backyard, based on where you're living.
So now let's take the next step, right? Because these things happen because they're supposed to happen, right? And now you're a board member of the top Lyme disease organization in the world, right?
Right.
Let's talk about that journey between getting diagnosed finally, being treated, and now you're a board member of this organization.
Yes. So, what's the question?
Talk about that journey. How you went from being Lyme ignorant,
right,
to now being a board member of the top Lyme organization in the country.
Oh, okay. Now I got it. Okay. So my doctor was treating me. And he was one of the ILADS founders, so he said to me, why don't you hang out with me? You're in Long Island, you probably have these patients and you don't even realize it. Well, he was right, actually. So I ended up hanging out with him in his office, sometimes 1 hour, one day, then more time. Then I did the ILADS training program. Actually, I spent a week with them. And then eventually he asked me to work with them. Actually, we got along really well, and he said I was a really good doctor. So he said, why don't you work with me? And I started my office, wound up selling my office, actually, and I wound up working in his office in New York City.
So
he saw patients from all over the world. It was very interesting, some super, super ill and complex patients. So that's how I got into it over there.
All right. So how long did you work in the New York City office before moving out to Florida?
About 2 years.
All right. So talk to us about your office now. Where is your office in Florida, and what type of Lyme patients are you working with?
Okay, so office now is in Delray Beach, Florida, actually. I do patients in the office as well as see patients on telemedicine remotely.
Okay.
So I do both. And I see mostly people that are chronically ill, very complicated, pretty debilitated, many of them. But I work very hard, take a good history, and we work hard on trying to get them better. It takes a long time. It's not a 5-minute office visit. You need a long time, a lot of blood tests. I do very thorough blood tests at specialty labs for Lyme disease. Some of them have mold illness as well. Some have mast cell activation syndrome. They can have many different things. A lot of them have GI issues as well. And we do specialty labs as well as routine labs. Sometimes you don't need a specialty lab. It's cheaper. We try to save them as much money as possible, do their labs that the insurance covers when possible. Sometimes those labs aren't as good for certain infections, especially the tick-borne infections. And for those, I use the specialty labs.
Okay, so I do want to invite you to do a long-form podcast. You're doing a fantastic job for us in the short window that we have together. But I don't want to end this interview without talking about the topic you presented on today, because my understanding is you're training the next generation of Lyme disease doctors, Lyme-literate doctors.
Yes.
So talk to us about how you're doing that and what you presented today.
Okay, I'm a member of the Medical Education Committee, and basically, we also had something called the tick-borne, vector-borne illness working group, so we updated that for teaching the newer generation of doctors. So each of us got a topic to speak about, and today I spoke about tick-borne relapsing fever, which is very interesting because people with this problem can have the same symptoms as Lyme disease. They could go to the doctor thinking they have Lyme. Doctor may say, oh, you're in the Lyme endemic area. You have symptoms of Lyme. Let's test you. And they do the regular Lyme disease test. It comes back negative. But there's a different test now. It's called tick-borne relapsing fever antibody or tick-borne relapsing fever immunoblot. Do IgM, IgG. They could do all of those. And basically, if you don't do that test, someone could look like they don't have Lyme. But if they do this test, they may come back positive, actually, with those symptoms. So it's important to look for that.
So now, are these tests available in a general tick-borne disease panel, or do you have to use a specialty lab to have this testing available to a patient?
I actually use the specialty lab for that. Yeah, that's why they use the specialty lab for that.
Okay, so these tests are not available in a Quest or
Actually, I'm not sure.
Okay.
Because the specialty labs are so much better. I typically go for the certain tick-borne infections. I go to them first right away.
All right, and what lab is that you customarily recommend that folks use?
Customarily, I use IGeneX Lab, actually.
Okay, great. And we've had IGeneX on our podcast many times, and yeah, they're a great specialty lab. Well, thank you very much, Doctor, for
thank you so much. It was very nice meeting with you.
Really a fantastic interview, and I'd ask you to just be open to working with us for a long-form podcast, because there are many, many questions that I want to ask you, and with more time, I think there's a lot you could offer to the community with a long-form podcast.
I appreciate that. I love helping the patients, and I love teaching other doctors to help other patients, too. So that'd be fantastic. I look forward to that.
Great, thank you. So we will absolutely be in touch.
Fantastic.
Thank you.